Across Vietnam today, the vast majority of diseases are now non-communicable diseases, causing over 65% of hospital deaths. 35 years ago, the corresponding figure was less than 45%. This massive increase is due to a combination of demography, GDP increase, urbanisation and markedly changed lifestyle. More motorised vehicles, more physical inactivity, more traffic injuries, more fast foods, more stress.
Before 1975, the term fast food was not in the Vietnamese dictionary. Now there is a growing popularity of takeaway restaurant and fast food stores. The consumption of fat doubled over the last decade. The number of motorcycles has increased incredibly, and 3 million are sold annually. One consequence is reduced walking and cycling, and thus much less daily physical activity.
9 in 10 people who die from non-communicable disease before the age of 60 come from low and middle income countries. And this has very serious implications.
At the same time as this large increase in NCD mortality, mortality from communicable or infectious diseases has fallen sharply from 53% to 15%. For Vietnam, NCDs impose a heavy burden on socio-economic development as GDP growth is reduced significantly. There is evidence that NCDs and their risk factors are also closely related to poverty at a household level. Heart disease and cancer greatly increase the likelihood of falling into poverty due to catastrophic out-of-pocket expenses and lost income from ill health. Which is why the current project also addresses the rights perspective of all people, regardless of socio-economic conditions, and so should contribute strongly to the development of a more pluralistic society in which all citizens can be empowered through better health. High-fat diets are a major factor in obesity and other NCD risks. Fast foods, even in developing countries, contribute to high-fat consumption. Policymakers are becoming increasingly aware of the burden they place on health systems. Too little physical activity adds to the risk of raised blood pressure and blood glucose, abnormal blood lipids, excess weight and obesity. Regular physical activity markedly reduces premature death and disability. Globally, WHO estimates that lack of physical activity is the 4th leading risk factor for all forms of mortality. More importantly, enhanced physical activity has a direct and substantial positive impact on other top risk factors, such as hypertension, high blood glucose, obesity, and high cholesterol.
Non-communicable diseases, especially stroke and myocardial infarction, is now the leading cause of death in Vietnam, approximately 3 times more common than infectious diseases. Overall, Vietnam society spends 4% of GDP on NCDs. At the individual level, an average Vietnamese person spends 3% of annual income out of pocket for the treatment of NCDs. Naturally, those directly affected spend much more.
Physical activity has numerous positive effects on health. It has primary prevention effects through reduced risk factor burden and thereby lowering the risk of ischemic heart disease, cancer and type 2 diabetes dramatically.
With the written prescription for physical activity, treatment can be individualized for each patient's condition and circumstances. It is essential that the prescription is based on a dialogue between patient and clinician. The written prescription is usually made on a special prescription form. A Swedish study in primary care demonstrated that over half of the patients adhered to the prescription after 6 months, on par with compliance figures from pharmaceutical drug studies.
Our solution addresses the needs for increased physical activity in patients with diabetes type 2 or hypertension. It is based on the prescription of physical activity, objective measurement, semi-automated recording of taken steps, and individual feedback through cell phone text messaging and internet. In designing our solution, we have considered the mentioned aspect
to provide a convenient, effective, user-friendly and long-term solution for promoting physical activity. For objective measurement of physical activity, we use pedometer, partly reimbursed by health insurance and governmental authorities. The objectively recorded data will be transferred to a central server. Feedback will be provided to patient and doctor, both electronically and at regular visit to the doctor. A web-based platform that all patients and their healthcare provider can access will be used for those with access to internet. It contains data about individual physical activity level, education about physical activity and health effect, and forum for communication. These feedback can motivate patients to better adhere to increased physical activity. Regarding the high coverage of cell phone network in Vietnam, we will use cell phone text message to remind and encourage patients to follow their prescription. The non-adherent patient will also be followed up with phone call.
Our proposed solution has several unique and innovative features for promoting physical activity. First, it is the first evidence-based and structured physical activity on prescription program to be implemented in a developing country. Second, the project involves compliance-enhancing feedback to patients using robust and simple interactive available technologies. Later, the solution can be adapted to new telecommunication technologies such as smartphones. Third and last, the solution includes a record of physical activity history. This enables patients and healthcare professionals to jointly analyze and discuss the pattern of physical activity and adapt the lifestyle changes accordingly.